Today we are going to talk about the extrinsic and intrinsic coagulation pathways, how to remember them, and why distinguishing between them is clinically useful in veterinary medicine. Secondary hemostasis is the process that strengthens the initial platelet plug by producing fibrin. Although the classic coagulation cascade divides this process into extrinsic, intrinsic, and common pathways, these systems interact closely inside the animal. Tissue factor initiates coagulation, while the intrinsic pathway amplifies thrombin production so that a stable fibrin clot can form. The extrinsic pathway begins when tissue damage exposes tissue factor outside the bloodstream. Tissue factor binds factor 7, and this complex rapidly activates factor 10. An easy way to remember this is, extrinsic exits the vessel and uses 7. Extrinsic begins with something outside the blood vessel, and factor 7 is its major numbered factor. Because this pathway is short and activates quickly, it acts as the spark that starts coagulation. The intrinsic pathway uses factors 12, 11, 9, and 8. One useful mnemonic is 12, 11, 9, 8, count down and skip 10. Factor 10 is skipped because it marks the beginning of the common pathway. Activated factor 9 combines with activated factor 8 on a phospholipid surface to activate factor 10. The common pathway then follows factors 10, 5, 2, and 1. Factor 10 and factor 5 convert prothrombin, or factor 2, into thrombin. Thrombin converts fibrinogen, or factor 1, into fibrin, and factor 13 crosslinks the fibrin to strengthen the clot. A simple memory phrase is 10, 5, 2, 1. Make the fibrin when you're done. In the laboratory, prothrombin time, or PT, evaluates the extrinsic and common pathways, whereas activated partial thromboplastin time, or aPTT, evaluates the intrinsic and common pathways. You can remember that PT examines the shorter pathway, while aPTT examines the longer pathway with more factors. A prolonged PT with a normal aPTT points toward an extrinsic pathway abnormality, especially factor 7 deficiency. Inherited factor 7 deficiency has been reported in breeds such as beagles, boxers, miniature schnauzers, and Alaskan malamutes. These dogs may appear normal until surgery, trauma, or parturition produces prolonged bleeding. Early vitamin K deficiency or anticoagulant rodenticide toxicosis may also prolong PT first because factor 7 has the shortest half-life of the vitamin K-dependent factors. A prolonged aPTT with a normal PT points toward factors 12, 11, 9, or 8. Hemophilia A is factor 8 deficiency, while hemophilia B is factor 9 deficiency. These inherited, usually X-linked disorders primarily affect males and may cause deep hematomas, hemarthrosis, prolonged surgical bleeding, or hemorrhage into the chest or abdomen. However, factor 12 deficiency, which is relatively common in cats, may cause a dramatically prolonged aPTT without causing abnormal bleeding because factor 12 is important in the laboratory test but is not required for normal hemostasis inside the body. Unfractionated heparin and improperly collected citrate samples can also prolong aPTT. When both PT and aPTT are prolonged, the veterinarian should consider multiple factor or common pathway abnormalities, including advanced anticoagulant rodenticide poisoning, severe vitamin K deficiency, liver failure, hypofibrinogenemia, or disseminated intravascular coagulation. In rodenticide poisoning, PT usually increases first, but by the time visible hemorrhage develops, both PT and aPTT are commonly prolonged. DIC may also produce thrombocytopenia, increased D-dimer or fibrin degradation products, decreasing fibrinogen, and fragmented red blood cells. The major takeaway is to match the abnormal test with the affected pathway. PT points toward factor 7 and the extrinsic pathway, aPTT points toward factors 12, 11, 9, and 8 in the intrinsic pathway, and prolongation of both suggests a common pathway or multiple factor disorder. However, normal PT and aPTT do not rule out von Willebrand disease, platelet dysfunction, mild factor deficiencies, or hypercoagulability, so coagulation results must always be interpreted alongside the animal's bleeding pattern, platelet count, medication history, and underlying disease.